Health Minister Kukwa Jumamenu says government has adopted a new strategy to achieve the target of eliminating HIV/AIDS epidemic by 2030. Speaking at the Meet the Press series, he noted the ministry and its agencies have faced challenges in dealing with HIV/AIDS since 2017. He, however, says steps are being taken to address the issue. Ernest Menu reports.
In 2014, the Joint United Nations Program of HIV/AIDS and partners launched the 1990 targets with the aim to diagnose 90% of all HIV-positive persons, provide antiretroviral therapy for 90% of those diagnosed, and achieve viral suppression for 90% of those treated by 2030. We were nowhere close to the 1990. 2017, we moved to 62%, 45%, 51%. 2018 December, our statistics indicate 69% for testing, 38% for treatment, and 66% for viral load suppression.
The increase in prevalence rate is a source of concern for government. Their efforts to reverse the trend and take Ghana back on track to achieving the 2030 target.
We have had challenges with procurement of supplies for treatment, and we have identified this area as an area that we need to improve. So that has become a challenge for us, and we are now adopting a new roadmap to tackle the HIV/AIDS challenge. And we believe that by 2020, we will change these indicators and move closer to achieving the 90 by 2020.
Meanwhile, government lost $19 million of funding for HIV because it failed to raise counterpart funding of $17 million. John Hughes, however, understands the Health Ministry is in talks with Global Fund to ensure the decision is reviewed.
Well, joining us in the studio is Dr. Nyonuku Akosia Badu, Head of Clinical Care at the National AIDS and STI Control Program. Thank you very much for joining us, Dr. Badu.
Thank you very much.
We're also live in Jamestown here in Accra to get to speak with some Ghanaians about their lifestyle choices and how aware they are about HIV/AIDS. I'll start with you, Dr. Badu Do. Where are we in our fight against HIV/AIDS?
Well, you know, currently worldwide, we have all adopted the UNAIDS strategy of targeting that 90% of people living with HIV should know their status by the year 2020, and 90% of all those who know their status should be on antiretroviral therapy, and 90% of those on antiretroviral therapy should be virally suppressed by 2020 in a bid to work towards eliminating HIV as a public health problem by the year 2030.
But this strategy that you talk about, there's nothing in there about educating people so that they are aware that they can contract HIV, as we had it some time back. And at this point, I want to share some of the messages that we used to see back then on TV, the adverts and campaigns we used to see on TV. We'll get to watch a bit of it, and then I'll come and we'll continue the conversation. All right, so Dr. Badu, we used to see a lot of these on TV back then. How come we don't anymore? And the strategy that you're talking about doesn't mention anything like this.
Well, the issue was when the epidemic first started in 1986. You know, at the time, we didn't have medication for antiretroviral therapy. So if you were HIV positive, it meant that you were going to progress, to get worse till you died. And so, sorry. And so gradually, you know, science developed, and now we have medications that can keep people alive to living 120 years. Okay. So HIV does not necessarily kill unless you are known to be positive and you don't take your medication, or you don't know your status at all and then you die from it. But otherwise, once you know your status and you take your medication, definitely you'll be free. So the trend changed from prevention in terms of using condoms and all that. The focus now for funding became making the medications available.
Essentially, the pipers are calling the tune.
Basically, yes.
But we have other needs. But let's go over to Jamestown now. We'll come back and continue the conversation. But let's go over to Jamestown now. Komla Adom is standing by. Now, Komla, you tell us you've been interacting with the people there. What have they been telling you as far as what they know about HIV/AIDS is concerned and whether they know about their status?
Israel, I've been interacting with some young men here, as you rightly put it. They tell me that, for example, when it comes to education on HIV and AIDS, in the past, say some 5, 6, 7, 10 years ago, they used to see a lot of adverts on television and listen to radio and even billboards sensitizing the young people about causes of HIV and how to handle it when you get the virus, and even the need for you to test once you suspect any unusual behavior. So let me just speak to Ishmael here, and then Nilante. In a short while, Esther will be joining us so that we have this conversation. Mini only about HIV. Mini banyehani ubana HIV.
Unprotected sex. Unprotected sex. Allo blade na keji wa mokeji iwana. Blade ni ekule use blade or mono na blade kan shibo use ekule full ni e kan je instead of sane chef got am e kan machine bo na ole no akono use u ban bo na kan HIV ekule me meji Hausa me di o wa na ne mo ko ne afu mo ko ni HIV me ko nke bo ba ji wa le wa no na infect.
Okay, so Ishmael is just saying he's enumerated a number of things. He said, one, if you have unprotected sex, you are likely to get HIV/AIDS. When you also use sharp objects that other people have used, you are unable to tell who used the sharp objects, but because it may have been used by an infected person, once you use it, there could be the possibility of contracting the HIV virus. He also mentions that the roving pedicurists also go around and then cut the nails of individuals in some of these communities. They cut the nails of one person without sterilizing the tools they use. They move to the next person. That is also an avenue for transmitting the disease. Now, Nilante, bominole about HIV, mini HIV.
Obi le ne jo kwe no komyo ole no kono go kla mi sun o kle te se no ni jin o kle na bole o kle le la ni gbe alo le la ni yo e we de kle ye bo e ji lo le ji no lo le se kle na bole san mi na ko e che bo ko le buya mi ke o check mo dan ni o ba no na le akewo ale no to anana ke mo awa ne ko ni ke mo awa ne kule kaji no na po doctor nye ke bo aga ona ni ke she kule your report ni ke ni bi ma ni no ba no le ako ona ne ke mo awa ne at the same time ni ke wo nye me Hausa me no fne se no di o wa na ji ne e ko ne ba nya ji mo ko wa na e ka ti mo ko ka kla ne yin ne ke ka te se ne nye fo ka kla e ko ne nye ke tu ni ne tu an ke check ka kla fo she fa ke you e fo ka kla e be fite no tu ma le no tu mo pese se ne nye ke yo ya ne ke aje mo ko ka e nye ke fo mo no
So Nilante also agrees with Ishmael. He says unprotected sex is one of the leading causes of HIV transmission. According to what he tells me, he also talks about the roving pedicurist. Ishmael, Bo, when was the last time on an advert about HIV/AIDS, your TV no allo radio?
Nah, your papa no, your papa no, nana can be in HIV.
From how many years?
Oh, I need to 2 years, 3 years, but I'm not quite a feeling that.
Okay, I just asked him when was the last time he saw an HIV/AIDS advert on television or even listened to it on radio or even a billboard or an ad in the newspapers. He says it's been a while. In fact, the last 2 to 3, 4 years, he's not seen any of such adverts on TV, on radio or elsewhere. Nilante, okay, you, Yana Bole, or use your protection?
Oh, to no turn again. Last day, money use protection. She, I don't know, you say, if you're to my own way, in the
okay.
No, catching work, you any BS, baby, Nijin, I can wear. Catching in Lele, Nicola Pele, fair safe, some money protecting.
Okay.
So,
Nilante, I asked him when was the last time he had sex and whether he used protection. He tells me he doesn't remember the last time he used protection when he had sex because the individuals he's been having sex or intercourse with, he knows them very well and so knows that they do not have this virus. She sometimes say tricky. By now, other people not virus say hello.
Oh, to no girl na kan. Baby on mo ake olile, okele ya kuturi. Allo okele yo no okele no nupo. She okele eyan mo miele, jo okele yin. To no chona kan. Okele ani le ke mo konklo ete anabole. Self tafache okele mo eneko. Ni kele wo. Kin ani na. Aga nje doctor ji oni onyo check le bon ka ji na kan no mole. Okele ne ko e. O ani ni bon oneko.
So he's just saying, I put the question to him that since he thinks the individuals he's been having sexual intercourse with are clean and so he does not need protection, it could be the case that these individuals may have gone to see other individuals and had sex with them. And so it is very important for him to use protection. He agrees with me, sort of, but he believes that all the people he's had contact with or sexual intercourse with are people who are clean. Let me bring Esther into the conversation. Esther is the only female joining us in this conversation. Esther, do you use protection when you have sex?
Actually, no.
Why?
Because the kind of man I had an intercourse with, I really know that man, and I don't really think he has that kind of disease. That's why.
But how sure are you? Because people do not walk about with inscription on their forehead that they have HIV.
So it's been a long time here since I know him, so I just believe that he doesn't have that kind of disease.
But don't you think it is a risk you are taking? Jay, it's very risky. Okay, if more for that long, he may have had a one-night stand with somebody alone. Look, something may happen along the line.
Signs, the symptoms come in. So I actually don't mind.
What are some of the symptoms you know people who have HIV show?
They grow long. Very soon, everyone most of the time for me.
Okay, so Esther is just telling us that Esther doesn't use protection for sexual intercourse because she trusts her man, according to what she says. And she says there are certain symptoms that she knows people who have HIV and AIDS present with. And this man she talks about doesn't have any of these symptoms. And so she is confident that this individual is clean. So Israel, those are the general sentiments here. Ishmael earlier, we had Nilante and now Esther sharing their thoughts about this HIV, the lifestyles that make them susceptible to contracting the HIV and whether or not they know about adverts or the sensitization about HIV around here at the V8 Plus pub at Bese.
And that was Komla Adom joining us live from Jamestown. And Dr. Badu, interesting revelations that came out there. So first of all, these people, it's clear, know about HIV and how you can contract the disease. But then the other interesting bit is that they say that they don't think that they should use condoms or protection because they feel they know the people they're going to have sex with don't have AIDS. They can tell. Could this be the reason why we're having an increasing number of new cases?
Yes. And you know, Israel, this is because people expect to see very sick people, bone thing, about to fall dead. But
which was the kind of campaign we had back then.
Exactly, because those were the people who were seeing the picture of HIV then. But now it has changed. You know, when you get infected with HIV, it can take up to 8 to 10 years before you become symptomatic. So between the time of infection till that 8 to 10 years, when you begin to show signs and symptoms, you have spread the disease. Because the virus is in there multiplying. About 10 billion viruses are produced daily. So when you have unprotected sex, and there's no way of looking into someone's face and say, oh, this person has HIV in the early stages of the infection. This person doesn't have it. No.
But so, people generally, I mean, that's the understanding we've had, that you see somebody, you don't think that if the person looks full in body, then you feel that...
It's a very erroneous expression or impression that we have. Yes. There is no way you can look in someone's face and say this person has or doesn't have HIV. We've had cases of people actually saying, I'm HIV positive, but they look healthy, they look well, because they're on medications and they are doing well on the medications. And then people are saying, oh, we want to have some fun with you and you don't want us to sleep with you. That's why you're saying you have HIV. You don't have HIV. You can't prove it to us. And they go in to have sex with a person, unprotected sex for that matter. Yes, so it is an error in our thinking. Yes, it's an error in our thinking that we have to change. Now, you won't see that. You see, the thing is, the sick person does not have the energy to think about sex. It is the healthy person who will have the energy to go and have sex, unprotected sex, with not one person, multiple partners. And in so doing, if the person is infected but is yet to show signs and symptoms, they are spreading it.
Now, isn't that the reason why we should have campaigns? Probably we would have to, you know, revise the campaigns or review the campaigns so that we're not showing the dead people and all that, but show healthy people who are having... Why don't we have campaigns like that?
Well, you know, currently we are grateful to Joy FM, for example. You've hosted us on several occasions to talk about HIV, and this is what we hope we are going to do going forward. Have the support of social media and all the media houses to reach out to people to talk about HIV and let them know that looking healthy does not mean you don't have HIV.
What do you think the campaign, or how do you think the campaign should now be shaped?
Well, the campaign message now is, the prevention message hasn't changed. You abstain until you get married. And I would advise that couples know their statuses and disclose to each other so they know what they are going in for. To each other, that's my emphasis. You don't need a third person knowing your status, but the two of you should know each other's status and be ready to support and stay with each other. And then be faithful to each other. One person to one partner, both of you being faithful to each other. Emphasis there. Then, if you will have sex with anyone other than your regular partner, use a condom. Could be a male condom, could be the female condom, but let's use condoms. You know, so we talk about the A, B, C, then there's the D, that is drug. So if you are HIV positive, there is medication. And when you take the medication properly, your viral load is suppressed. You don't have a lot of viruses growing in your body. And so your risk of transmission is markedly reduced. In fact, now they are saying undetectable viral load is untransmissible. So then you do that and you make sure that education goes out. So we need everyone to come on board.
Right.
The health service, everyone, media houses. Let's come on board. Let's talk about HIV at every opportunity.
All right. Thank you very much, Dr. Nyonuku Akosua Badu. Dr. Nyonuku Akosua Badu is is the head of clinical care at the National AIDS and STI Control Program. We're taking a break. Business News comes up thereafter.
Can't stop oh mama, hear my cry. And you're ready, and I'm the permanent here. And then we could be saying, I see I saw question. You've been a year now when you're my home. Answer. Yari, kiss your nanny, dig it to the international crew. You're gonna call on medium. When you get www.com with me to the summer home. Some of the stop. Now we are some my attack, me up on Jamaica, mammy.
Charlie, there is nothing wrong with having good sex.